and some support groups. So we're going to get back at it again in this room. We're talking about Scanxiety and mental health, and hopefully some tools to put in the toolbox, right, for that. And then over in the other room, we have the session with Lynn's on ink and intentions. So it's my pleasure to introduce you to Carly Temple. She received her master's degree from the Mandel School of Applied Social Sciences here at Case Western Reserve University and has worked at the Cleveland Clinic since 2016. For the last 7 years, she served in her current position as an outpatient clinical social worker in hematology and oncology, where she supports the melanoma and benign hematology programs. So please welcome Carly.
Thanks, everyone. And I will try to make this as engaging as possible because I know it's been a very long day. This is the last session. Oh, thank you. I'll try to make this as engaging as possible. I know it's the last session of the day. I'm sure people are fizzling out a little bit. So thank you so much for having me. I'm going to be talking today about mental health and Scanxiety. And I hear you've touched a little bit on this already today. So hopefully I'll go over some new things. You can put some tools in your toolbox and we'll have, a good conversation about it. All right, so some of the things we'll cover today, we're going to be talking about mental health. What exactly does this mean? We hear that a lot, but I want to talk about, what this means, what things to look out for. Specifically, Scanxiety. What is it? What are some tools to help manage it? What can you take home and use next time you encounter that? Knowing when to ask for help. I'm going to give you some tools today. Sometimes those tools aren't enough. Sometimes you can fill your toolbox and it's still not enough for you. So we're going to talk about some of the signs of when to ask for help. And then when you do ask for help, where do you go for that? Where are you going to get more support? We'll talk a little bit about that too. Okay, so again, I'm going to try to make this engaging. When you hear mental health, again, this is something we hear all the time, mental health. What exactly does that mean to you? And feel free to shout it out. Stress. What was that?
Feeling good.
Feeling good. Okay, mental health means feeling good. Quality of life. Absolutely. Sense of balance. Love that. Yeah, mental health can mean feeling balanced, feeling well, good quality of life. Anyone have anything else?
Not going insane.
Not going insane. Absolutely. Yes. Very important. What was that? Feeling in control. Yes, we hear feeling in control, feeling balanced, that equilibrium in your body. Absolutely. Okay, so the kind of those negative things we think of, not feeling those things means mental health. Yeah, absolutely. Those are all great. So yeah, mental health might include all of those things we just mentioned. It might include mood, obviously things like depression, anxiety, I hear stress, your behaviors, it can influence, what you do, how you do it, your social connections, whether or not you're getting together with friends, family, that sort of thing. Your thinking, coping, functioning, these are all things that mental health can include. When I practice, we use what's called a biopsychosocial model. And what that means is that we understand that the mental health piece is not just mental health, it affects all of these things. So what you guys said today, that's great. You picked that out. You know that it affects more than just your mood. It can affect all of these things together. So when we're talking about cancer care specifically, cancer can affect mental health in a lot of really specific ways. I'm sure all of you have encountered a lot of these things. Obviously mood. So we're talking about depression, anxiety, irritability. Irritability is a big one that people don't necessarily link to their mental health. You're feeling more on edge, you're snapping at your family members more. That's often a sign of depression or an anxiety disorder even. And a lot of times people experience that first before they kind of experience the other things. So it's a big thing to look out for. Cancer care can affect mental health because of the physical impacts. You can't do what you used to. Maybe you used to love jogging, 5 miles a day. You can't do that anymore. That can in turn impact our mood, your ability to work or engage in activities. This kind of goes along with role changes. Maybe you were the primary income earner for your household for the last 20 years. All of a sudden, you have to apply for Social Security disability. You're not working anymore. That's a major role change. Maybe, you were the primary caregiver for your 3 children. You can't do that anymore. Again, that in turn can affect our mood. It can affect our functioning. Going back to that biopsychosocial model, everything impacts each other. Obviously, finances. I know the session before talked a little bit about finances. That's a huge stressor for folks who are going through cancer treatment. And that can obviously affect stress, things like that. And self-worth. We talk about demoralization a lot. This idea of who you are is different from who you thought you were. You aren't the person that you once were, and you're struggling to kind of adapt to that change. These are all ways that cancer care can affect mental health. So I want to ask you folks, what are some of the ways that your cancer care, if you're a caregiver, watching your loved one go through their cancer treatment, or even your own experience, what are some ways that you've noticed that cancer care has affected your mental health? And again, feel free to kind of shout it out. What was that? Irritable. Yeah. Yep. That's a big one. Irritability. Absolutely. Isolation. Mm-hmm. Yes, absolutely. So this idea of what our life was supposed to look like and adjusting to this kind of new normal. Life doesn't look the way that we thought it would. That can be a big source of stress, a source of, a changing self-worth. Absolutely. Yeah. Yes, I love that. So kind of on the opposite end, that's almost a positive impact in some ways, where going through something so life-changing like a cancer diagnosis can also impact, meaning and self-worth in a positive way, potentially. Absolutely. Thanks for bringing that up. So next we're going to talk about obviously a big aspect of cancer care that can contribute to mental health and well-being, which is Scanxiety. I was going to ask you folks who has heard of that word before, but I'm sure 100% of the people in this room have heard of that. So just throwing up the definition here, which again, I'm sure you're familiar with. Scanxiety, which of course is scan anxiety, is defined as the distress and or anxiety occurring before, during, and after cancer-related imaging or scans. Does anyone have anything to add to that definition at all? Roller coaster. Yes, absolutely. That's a good word to capture it. I like that. Any disease. Okay, scans related to any disease can induce anxiety. Yes. Yes. Absolutely. Yeah. Absolutely. Yes. Excellent point. So we hear the word Scanxiety used a lot in cancer care. You are 100% right. That can be applied to any other diagnosis where you have to get scans. You're nervous about those results. It's distress inducing, anxiety inducing. Absolutely. Anything else before we go on to the next slide here? So next I'm going to talk a little bit about ways to cope with it, which I think is probably the meat of the presentation today, is coping with Scanxiety. So research shows that using these skills listed here, so distress tolerance, acceptance-based therapies, mindfulness meditation, These are some of the absolute most effective ways that you can deal with Scanxiety, with the anxiety, the stress that comes with getting scans, as we, discovered, not just for cancer care, for anything. These skills here are actually rooted in an evidence-based practice called dialectical behavior therapy. Has anyone heard of that before? Okay, a few people have. So what this is, again, it's an evidence-based practice. It's used, by mental health providers. It was developed in the 1980s by a psychologist named Marsha Linehan. It was actually primarily used to treat folks who had personality disorders, primarily borderline personality disorder. After the 80s and more research was done, they realized that DBT, again, dialectical behavior therapy, can actually be applied in other areas, and it was found to be really effective for folks. So one of the areas that it's really effective is people with like chronic suicidality, for example. It's really effective with those folks, folks who have patterns of self-harm, that sort of thing. Newer research, because the research on Scanxiety is pretty new still, newer research is showing that this is also really effective for dealing with Scanxiety. The core tenets of DBT are really this acceptance of our present reality. It is almost a recognition that pain is inevitable in life. We go through really tough, really stressful things. We can't stop that. That is part of life. That's part of being human. We have to live with that. What DBT seeks to kind of address is preventing that pain from turning into suffering. It's acknowledging, I'm going through something really hard right now. I'm going to be okay with that. I'm going to get through that. Let's keep that from getting worse than it is. That's really what DBT is. And the reason that's so effective for folks who are going through cancer treatment or another health diagnosis where you're dealing with scans is that this is something we can't change. You can't say, oh, I'm not going to get any scans anymore. You can't say, oh, I'm not going to get cancer treatment anymore. I mean, you could, but the reality is, if you are moving through your treatment plan, this is a part of it. It's something you have to deal with. So what we want is to prevent that pain from turning into suffering. And so I'm going to go through some different skills that we can use to hopefully help do that. And I'm actually... So I'm just going to pass around a little worksheet I have. I have a bunch of copies of it. Feel free to pass around. Take one if you want. You can pass it on if you don't want. But it's going to go through this first skill I'm talking about, which is the accept skill. So I'm just going to put this at a couple tables and then feel free to take it and take a look at it. Thanks. Okay. So while they're passing that out, I'll start to go through it. So this skill, accepts, is an acronym, and each letter of the acronym stands for something that you can do to help manage that distress. It focuses a lot on using distraction techniques, which are really easy to use for a lot of people. It's not something where, you have to see a psychologist or a social worker or another mental health provider to use. You're able to just kind of use these on your own, which is great. So this first one here is activities, doing something that requires your concentration. It could be reading a book, it could be gardening, just something you enjoy that kind of distracts you, gets you engaged in something. We go on to C, contributing, something that allows you to focus on another person. Maybe you want to bake some muffins for your spouse. Maybe you want to write a letter to someone, something like that, something where you're putting your energy into caring for another person. Comparisons. This one, some of the examples I don't love as much. So it does say, realize how resilient you are by thinking of someone who's potentially coping less well than you. I don't love that one as much. What I really like is that this also focuses on a time where you were able to get through something really hard. Maybe you had a scan before and you were really anxious about it, but you got through the scan, you got the results. Maybe you think back to that time and say, hey, I got through that time. I was okay. I came out the other end okay. So that can be the comparisons piece. Emotions, creating a new emotion, kind of opposite the one you're currently feeling. If you're feeling really anxious or really sad, watch a comedy special on TV, just seeking out something that's kind of opposite of what you're currently feeling. Pushing away. This one can be a little bit hard, avoiding a situation or blocking it using a technique like imagery. I find that that can be a little abstract for some people. So for this one, I really like to use like a guided meditation, which we'll talk about a little bit more too. They have a bunch of apps on your phone you can pull up that can be really helpful for kind of pushing those thoughts out of your head. The next one, thoughts, shifting your thoughts to something neutral. So again, this is kind of getting back to the mindfulness, the meditation. I like to use the 5, 4, 3, 2, 1 technique, which has anyone heard of that before? Okay, some people have, and people do it a little bit differently. There are different ways to do the technique, but it is looking around you, finding 5 things that you can see, 4 things that you can touch, 3 things that you can hear, 2 things that you can smell, and 1 thing that you can taste. And it's just a way, again, to kind of distract yourself, ground yourself, put you in touch with what is currently around you, really bring you to that present moment. That can be a really effective tool. And then finally, the S, sensations, finding a safe keyword, physical sensation to distract you from distressing emotions. Some of the examples it gives are things like holding an ice cube in your hand, eating something spicy. It can even be something more mild than that. It could be you have a hot cup of tea and you're really savoring what that tea smells like. You're savoring the warmth of that tea. It could be something as simple as that. So this is just one tool that you can use. You can, on the back of this worksheet, kind of fill some things in on your own too, if this really resonates with you, to just come up with some things ahead of time, because sometimes when you're in that moment, it's really hard to think of what exactly you want to do that's helpful. So definitely, if this resonates with you, I'd really encourage you to kind of go through this worksheet, fill this out, and then you can keep this in your toolbox. Any questions about the ACCEPTS acronym before we move on to mindfulness and meditation?
This seems like a good idea, provided the results are good. Yeah.
Mm-hmm.
If the results are bad, oh, John, everything he's gone through, wondered what your opinion is. I think this would be helpful, but if you really get bad results,
Yeah,
you know, life change, right?
absolutely.
I know you talked about that earlier. Maybe we know the answer, but yeah, there's a reality side actually. So that's back. Back to what we had bad results.
Of course.
That's a good one. Oh, yeah, sorry. Yeah, so I was saying the thinking back to a bad result, would be the implication of that. That's not necessarily good, but at the same time, I think about, anxiety, it seems, has a purpose, right? If it's in the proper context. That is to say, if I'm feeling anxious about a test that's coming up next week because I'm in school, my answer could be I need to study more, or I need to go get some rest, or I need to take a break and go run, something to address that feeling that I'm having. The anxiety that comes with a pre-scan thing changes nothing about what I can do with respect to the outcome of that scan, right? Nothing I can think, prepare for, or whatever is going to make that scan better or make the process easier. That said, I can think about, and I think this is where the accept stuff comes in. I can think about the things that direct that thing that's making me anxious to something that's useful for me. That is to say, I can still do things like I can go for a run, or I can have that cup of tea, or I can do those things. So I think it's a matter of, in my mind, for me, addressing what is this anxiety about and what effect can I have based on feeling that way on what it is that I'm doing. For a lot of things, anxiety's got a great purpose. In this one, it just, my engineer brain says it doesn't do me any good to be anxious about it because it's absolutely going to affect nothing. So yes, I might be nervous about it, but there's things I can deal with the nervousness by doing something else to get my brain off of it.
Absolutely. And I appreciate that point, because you're right. This does kind of require the pre-thought of, is this something where this anxiety isn't helpful for me? And in the case with, when we're talking specifically about Scanxiety, like you're saying, usually the answer is no, this anxiety isn't helpful for me. And again, going back to those core tenets of DBT, which is preventing that pain from turning into suffering, it's recognizing we might get bad scan results. That might happen. But when we have those results, how do we prevent that from getting worse? When we know that we can't change that result, we have to deal with that. We have to move on. We want to prevent that from turning into more suffering. You touched on too, all of these skills, they might not be for everyone. That's okay. Pick and choose what works for you. Trying it is better than not trying it, but I absolutely do not expect every single thing we talk about to resonate or work for every person. But I so appreciate that input. So I'm just quickly going to touch on the mindfulness and meditation piece. We only have a few more minutes here. For mindfulness, I don't think we have time to go through the exercises. A couple I'll just go through quickly. Square breathing is one that I love. And what square breathing is it is breathing in while counting to 4, holding that breath for a count of 4, breathing out while counting to 4, and then holding it for another 4 counts. When you are feeling like your body is kind of ramping up, you can feel it. You can feel your heart racing. Maybe you're getting sweaty. Maybe you just know what it feels like when you're getting anxious. Try to use this tool for a couple minutes. Do it for, 60 seconds, 90 seconds. See how you feel after really bringing the attention back to your breath, back to your body, trying it. It's really easy to use. Just remember square breathing. Next time you're kind of feeling on edge, give it a try. See how it goes. Another one I really like is progressive muscle relaxation. Has anyone heard of this? Okay. Yeah. So that's a great tool to use for those who are not familiar. It's basically tensing different parts of your body and then releasing them. And what it does is it kind of brings back, this idea of knowing what your body feels like when it's tensed versus relaxed. And after going through it, it can actually help us, come back down, relax our body when our brain is able to tell the difference between tensed up and relaxed. The meditation piece, I really, really like guided meditation. I think meditating on your own can be really challenging when you're just sitting down and you're saying, okay, I'm going to try to bring my thoughts back to myself or block out my thoughts. That can be really hard for a lot of people. It's hard for me. I'm not able to do it without a guided meditation. There are different apps. There are free apps that are really great for this. This is really good to use if you aren't sure what to try. You want someone to kind of guide you through things. Insight Timer is the name of one app that's really helpful. Plum Village is another one that both of those you can access for free through the App Store. They have a bunch of different guided meditations. And then if you don't want to do apps, even going to YouTube, finding some guided meditations that way can be really helpful. What was that? Yeah, Insight Timer is the first one. And then Plum, Plum Village is the second one. And they both have really great free versions of those. Okay, so now that we've kind of gone through those tools, you have things that you can try on your own. I want to talk about, what to do if things get worse and kind of what to look for to know if things are getting worse. It can be trouble sleeping. Maybe you're sleeping way more than you used to. Maybe you're sleeping way less, waking up in the middle of the night, not being able to fall asleep. Changes in your appetite, eating way too much, eating way too little. Obviously, the mood changes. We heard irritability a lot, depression, sadness, tearfulness, anxiety, feeling really stressed out. If those are kind of getting to the point where you're not able to use the skills you have to really work through those, that can be a sign, things are maybe getting to the point where some extra support could be helpful. Being unable to keep up with tasks like work. You're not able to go to work anymore if you're working. Maybe you can't do the laundry anymore because you're feeling, so unmotivated. Going to energy and motivation. You don't want to hang out with your friends or your family anymore. Those are all signs that, things might be getting a little bit worse. Maybe we want to kind of pull in some extra supports in terms of dealing with all of that. And so where exactly do we get that support? You're probably familiar with a lot of these already. First and foremost, your medical team. With mental health, we also want to rule out any medical cause for things first. So when we're talking about things like appetite changes, sleep changes, a lot of times those have a medical cause. So absolutely talk to your doctor first, because we want to rule out anything that's going on medically before we kind of assign a mental health reason to that. It could be your oncologist, a primary care doctor. If you have a social worker on your team, those are all great people to talk about any changes you're noticing in your mood or functioning. SAMHSA, which is the Substance Abuse and Mental Health Services Administration. They have a very robust website of different services, different supports that you can search for in your area. Lots of things you can print out. They're a great place to start if you're not really sure what exactly you're looking for in terms of support. I know a lot of folks are coming from out of state. These likely exist all over the country. Cancer support communities. So here in the greater Cleveland area, we have the Gathering Place, Stewart's Caring Place. I know other states have similar organizations. These are basically free support communities where anyone who's affected by cancer, so it can be the patient, the caregiver, you know, a friend, a loved one, anyone, can go and get support for free. That support might include support groups, individual counseling, specific groups for like children or teens of folks who are diagnosed with cancer. It could include nutrition information, wigs even. So they have a ton of services, a ton of support. I really like referring folks to these places. And then if you're kind of a do-it-yourselfer, Psychology Today is great. You can search for mental health providers in your area. It could be therapists, it could be psychologists. It's a really good place if you know exactly what you want. You just need to find a provider that's in network with your insurance. Definitely recommend Psychology Today. And that's all I have for you folks. And we're 1 minute over time. Any final questions?
That was great, Carly. I'll mention a few other resources for you all. The